Okay. Okay, very good afternoon, all the faculty members. A warm welcome. Otpri program sponsored by AICT. A warm welcome today speaker, eminent personality, Professor Sriram sir, and is famous in the entire South India in the pharmacy practice department. You have a very fortunate enough such you have such a eminent personality for delivering the lecture for the benefit of the faculty community. With these words, we now introduce the speaker to the participants.
Thank you, sir. A very good afternoon to all respected stakeholders of this 6 days AICT-sponsored online faculty development program on pharmacy education and research, present and future challenges, being organized by Jntua OTPRA. I am K. Vino from the Department of Pharmacy Practice. Feels blessed to read out the vivid profile of an eminent resource person of this afternoon session. That is Honorable Dr. Sriram Sir Garu. Dr. Sriram Sir Garu currently works at the Department of Pharmacy Practice at Sri Ramakrishna Institute of Paramedical Sciences and College of Pharmacy, Coimbatore. Dr. S. Sriram Sir has completed his bachelor degree from the Institute of Pharmaceutical Technology, Annamalai University in the year 1990. After bachelor degree, he worked with Glaxo India Limited at Delhi and Haryana for 2 years. Then he joined Cadila as area manager and was working at Mangalore for 1 year. During 1993 to 1995, he did his post-graduation in pharmacology specialization from JSS College of Pharmacy, Ooty. He secured gold medal in the M-Pharmacy and got the Best Outstanding Student Award. He has completed his doctoral program in the field of evolution of adverse drug reaction and drug interaction monitoring. In 1995, he joined College of Pharmacy, Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore. Presently, he is heading the Department of Pharmacy Practice. He has got more than 100 publications in various national and international journals for his credit. He has received the Best Teacher Award from the Tamil Nadu. Dr. MGR University, Chennai received from the Governor of Tamil Nadu during November 2011. He is the chief editor of Pharmacy Practice newsletters released from his institution. He is also the advisory board member and reviewer from various Indian and international journals. He also serves as doctoral committee member in various universities. He has delivered lectures in various national and international conferences on various topics like clinical research, pharmaceutical care, medication error, clinical competencies, etc. He served as Inspector, Pharmacy Council of India and Board of Studies member in various universities. He has received the award for Outstanding Pharmacy Faculty of the year 2017 conferred by the IPA Anantapuram branch. He is appointed to serve as Secretary of the Bioethics Units of the International Network of the UNESCO Chair in Bioethics in proclamation of the establishment of Regional Nodal Center for Pharmacy Bioethics Program at Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore. He is also nominated as Associate Secretary, Central Executive Council, Indian Pharmaceutical Association Education Division for the year 2018 to 2022. He is the life member in various associations like APTI, IHPA, IPA, IPGA, and ISPO, etc. I am very much thankful to the organizing committee of this faculty development program for providing me this opportunity. Thank you, sir, and thank you, everyone.
Yeah, thank you. Thank you very much for the nice introduction. In fact, it's my proud privilege to be associated with you all, right? At the outset, I would like to thank your principal for calling me for this faculty development program. I'm really happy to be associated.
Thank you, sir.
So I may be permitted to share my slide.
Yes, sir. Thank you very much. And you are.
Whether my slide is visible?
Yes, sir. But the screen is there.
Yeah. Is the full screen visible now?
Yes, sir.
Okay. So, a very good afternoon to everyone present over here. And I'm sure it is very difficult for a speaker as well as for the listener during the postprandial session, that is the post-lunch session. It is really a tough job for both the speaker as well as for the listeners. So anyway, I'll try to do my best. Right at the outset, my hearty welcome to all of you, right, to this FDP program. So this always, I believe, working with heart, because working with heart really works. So even though we have a lot of organs in the body, heart is the one which uh, keeps you always alive. And whatever it receives, it keeps giving it. Whatever it receives, it keeps giving. Right? Heart is the one which doesn't keep anything with it, it keeps giving. So it pumps everything, whatever it receives. So that is why I correlate this with the teachers, because teachers are the people who need to give whatever best they can to the students. And always it is better to keep giving to the students the knowledge, whatever you have gained, and also whatever you are possible to give, you can give it to the human fraternity. So my topic, the given to me, is problem-based learning, an effective tool in integrating theory and practice. So at the outset, as I've told you, it is very problematic to keep everybody alive during the post-lunch session. That is the big problem for me now. And apart from this, there are a lot of things we face. See, we face problems like COVID, the pandemic, which kept us apart, even though we say 6 feet distance. The technological advancement had made us to be very close through internet. And thank you very much for all those technological advancements, right? So am I going to talk to you anything new? So whatever I'm going to talk, it is all there in the internet, right? So anybody who wants to know something, any information, very well you can go into the internet, you can have the information. But one thing we have to be very clear, what need to be taken and what is the authenticity of the information from the internet. That is what is very important. So here, I'm going to tell you one thing. Education is not just learning the facts, but it is training the mind to think. So just whatever facts available, the statistical data or whatever it is, if you just give the information, it is not the education. Education is making the mind to think. Training the mind to think is education. I'll give you this two pictures, and I'm sure all of you will like the picture in the left side. That is the picture which is a smiley, isn't it? So anybody who wants to see you, they want to see you in a good face, with good face, with a smiling face, right? So we teachers, even though we have got lots and lots of problems, especially during COVID conditions, I know there are a lot of places where even the salary was not given. There are a lot of places where only the 50% salary is given. So once the salary is less, all the commitments what we have got a lot of commitments, either the commitment to pay the EMI of your housing loan, or for the vehicle loan, or you would have planned something else, right? So everything has to be faced, all the challenges need to be faced with positive attitude. You know, all the organs in the body keeps functioning without asking us. You know, heart keeps pumping 70 to 75 times per minute. The brain keeps working. There is constant blood supply to the brain, right? So always the organs, the vital organs keeps working without asking us. But we are the one, we have to have some stimulation to work, and that comes either from outside or by self-motivation. So all such type of FDP programs will help you to have motivational work. If you see the cell, each and every organelles of the cell, as it is shown in the picture, it has got its own functions. Everyone will say that I am the best, I am doing my work. See, if you see mitochondria, it says that I am the powerhouse of the cell. I really, without me, nothing is going to happen. So remember that each and every student has got the capability. As a teacher, what we should remember first is each and every student is capable. But only thing is how to make them productive. That is very, very important. Each and every cell will have a connection between them. They will have a decision when to release a particular hormone or when to go for a particular work. Say, for example, the parietal cells in the stomach, during the lunchtime, they start secreting the, according to the circadian rhythm, they start secreting the hydrochloric acid. They start secreting the intrinsic factor. So a lot of things can happen only with coordination. It is not one man, it is a teamwork that we need to understand first. There is one thing which is very, very important whenever we wanted to do a good work. We should be stress-free. We should be stress-free. During stress, we will not be able to do or perform, or the outcome is not productive. Always remember that we should be stress-free. Just see this picture, a small child with a chocolate cake. See the face. There is no stress in this face. The entire world for this child is the chocolate cake, what it has got. I'm just taking the example of a lady. She is also a teacher. Her name is Louis Hay, and she was identified to have breast cancer in the age of 54, and doctors have told that she will not be alive in 2 to 3 months, and she's going to die in 3 months, and she has got the 4th stage of breast cancer. You know what she did? She did not bother about all those things. Okay, I'm going to live another 2 to 3 months. Let me just do whatever best I can. She started giving whatever the wealth she was having. She was really happy about it. She felt happy when to make others happy. So all these things went on, and till 90 years, this lady lived. So I can say it's a medical miracle because all the intentions, the positive thoughts make you better. I tell you, in our body, we have got a lot of hormones, a lot of chemical substances in the body. All these chemical substances are secreted according to our thinking. Say, for example, when we see a snake, suddenly, right, fight or flight mechanism, you would have studied. So this adrenaline gets secreted more. You get excited, you get anxiety. There are some hormones in the body called as happy hormones. For example, serotonin, hydroxytryptamine, or dopamine, endorphins, oxytocin. They're all called as happy hormones. So depending on our mental status, these chemicals are secreted in the body, and we need to keep all these chemicals in balance. Happiness is again a choice. Happiness is a choice. For everyone, one thing makes them happy. For example, I'll tell you, for some people, listening to music gives them happiness. For some people, watching a movie, of course, with a good partner, gives them happiness. For some people, morning itself, diving in the swimming pool and swim for some time gives them happiness. A set of friends going for a long bike ride gives happiness for some people. For some people, working out in gym in the morning or in the evening gives them happiness. For some people, playing some games with their classmates or with their friends gives them happiness. Dancing gives happiness for some of them. Counting money again and again gives happiness for few. Reading books. Books are said to be very good friends. Reading books gives happiness to few of them. And shopping in the mall, especially for ladies, those who are given with the credit cards, the shopping in the mall gives them happiness. Photoshoot. gives happiness to few of them. Chatting with the friends gives happiness. So happiness is a choice. So doing activity, a group activity, gives happiness for some people, right? Traveling with the friends gives happiness for few of them. Taking jewelry gives happiness for few of the ladies. So happiness is again a choice. But among all, you know which is the real happiness? The real happiness is helping others without expecting something in return. That is the real happiness. And we teachers have got the chance to help people, especially the real teacher. The happiness is in the classroom when he or she makes the student understand certain concepts, make them to realize that yes, few of the students in the classroom, I could make them to understand the concept. That is the real happiness a teacher will have. Always learning, there are two types of learning are there. One is passive learning and another is active learning. You know, it is said that people generally remember only 10% of what they read and 20% of what they hear and 30% of what they see and 50% of what they see and hear and 70% of what they see and write and 90% of what they practically do. That is the active learning process. In our pharmacy education, there are lots and lots of subjects are involved. This is one course which I can challenge anyone that the number of subjects are more when compared to any other course. So ultimately, whatever we study, starting from anatomy, physiology, biochemistry, pathophysiology, or pharmacology, pharmaceutical technology, chemistry, whatever we study, ultimately where it has to help the student, it has to help in the therapeutics. It has to help in the treatment part, management, because we all say that we are all very much specialized in medicines. So in therapeutics, in the treatment part, we need to be very, very specialized. So education, there are two basic things we need to understand. One is knowledge based. Of course, knowledge anybody can gain, because whenever a student does not come to the class, he can go through the books, he can gain the knowledge, what the teacher has taught that particular class. But always remember that practice-based knowledge is very, very important. Knowledge and skill. Skill is developed only through practice. How to use the knowledge, the practical approach is very, very important. That is the knowledge-based and practice-based education. Coming to the topic, what is this problem-based learning? The problem-based learning ultimately has to enhance the quality of the graduates, right? Here, the basic thing is you give a problem and then try to sort it out. You don't teach them much, but you give the problem and ask them to analyze the problem. So it is again student-centric, problem-based, inquiry-based, and it is an integrated, collaborative, iterative, and learning methodology. Let us see what is the importance of this method, problem-based learning, whereas what is the difference between this didactic learning. Didactic learning is the conventional learning, blackboard teaching. So this knowledge refers to learning the principles, concepts, and information regarding a particular subject. As I've told you already, knowledge anybody can gain, either from the books or from the World Wide Web, or there are a lot of opportunities, a lot of resources are there to gain knowledge. But skill is application-oriented knowledge. This skill refers to the ability of applying the information in a context to improve the patient care. Ultimately, we pharmacists, as I've told you, we should be, whatever we study, it should help in the therapy. It should help in the patient care. So the objective of the problem-based learning is to create an experience for the students through practical training so as to implement the theoretical learning in day-to-day operations. So it is nothing but, in a simple language, we can say that integrating theory to practice is the main aim of this problem-based learning. So integrating the theoretical knowledge into practice on which the students will build their practical skills. In problem-based learning, the student or the candidate is allowed to ask more questions. Why, what, when, how. So such type of questions will trigger their mind, will kindle their mind, and they study more pertaining to that problem. So this problem-based learning, especially in pharmaceutical education, it has proved to be successful in abroad countries, and it develops certain qualities in the student. For example, the critical thinking ability, leadership qualities, self-directed learning, professional and interpersonal skills, team working skills, management skills, collaborative learning, English speaking qualities, and practicing empathy. So these are the qualities whenever a problem is given to a group of people, and when a teacher sits there, not by teaching, he is just a facilitator. The teacher here, in case of problem-based learning methodology, the teacher doesn't teach much, but he will be the facilitator to make the student think more. For example, I tell you, you want to discuss about the adverse drug reactions to the students. What you can do is, instead of saying, as per the WHO definition, adverse drug reaction is toxic, this is the definition of, you can just read the definition. That is not a big thing, right? Unintended, unwanted side effects, right, in common dose. According to WHO, what is the definition that can be read? But for effective learning, in case of problem-based learning, instead of telling them directly about the adverse drug reactions, we can just give them a word called as phocomalia and ask them to go and refer and come for discussion. So a group of people will be given this particular word. This is called the trigger. So this trigger is given to them. When they go and search, they will know that thalidomide had caused this phocomalia in 1960s, and the adverse drug reactions, what it has caused, more than 10,000 children got this, except in US, in America, right? So a lot of things will be learned from them. And in America, there's not even a single child affected with this phocomalia, because that particular place, the pharmacologist, namely Kelsey, her name is Kelsey, she did not allow this thalidomide to get marketed in US, because she was not happy with the clinical trials done on the medication. She was asking for more information. So that is how the drug was not there in the market in US. Now, we all know that this particular drug has come to the market, especially for morning sickness in pregnant women. And this particular drug was banned that time. And now the drug has come back again to the market for the treatment of multiple myeloma and leprosy. So by giving just one word as a trigger, that is phocomalia, you get a lot of details to be discussed among the students. So when we discuss about phocomalia, they will know more about the pharmacovigilance. They will know that when the WHO has started this pharmacovigilance and who are the partners, everything can be shared, especially by giving a trigger. And the trigger here is just a word, that is phocomalia. Always remember this problem-based learning. We have to introduce a problem and search for the facts and ideas. A brainstorming session has to be kept. That is, a group of students will be discussing or debating about that particular topic. They address the learning needs. They have to solve the problems in it. And finally, they have to come to a conclusion, the points about that particular problem. Here, if you see, this is the taxonomy of problem-based learning. There are different educational methods are there. Number one is lecture-based cases. Here what happens is, there will be a lecture given by the teacher and a case will be discussed. Only the teacher will be talking here. This is lecture-based cases. Another education method is case-based lectures. Here, a case will be presented before the lecture and the students will be studying that and coming. Again, the lecturer only will be talking. The next method is case method, where a complete case is given to the student prior to the classroom discussion, and which will be facilitated by the tutor. So this is student-directed and teacher-directed learning methodology. Another is modified case-based. Here, there are sequential problems are introduced into the case, and the students will be asked to decide, and the student discussion will be more when compared to the other methods. Problem-based learning. The students are presented with the patient problem and allowed free inquiry in tutorial groups. So these tutor groups, especially when the group of people are there are lots of ideas which comes from each and every student, and this will be discussed, and the teacher will be just a facilitator rather than teaching them the entire thing. So another method is called as closed loop or iterative method. It is the extension of PBL learning. Here what happens is, after initial problem solving skills, the students are asked to reflect on the information and the process they used and return to the original problem. So how did they come out with the discussion? How did they come out with the points? So the students will be asked to recollect how did they come out with the points. If you see here, there is one methodology called as Barrow's scoring method. Here, these individual education methods are ranked like motivation for learning, self-directed learning, clinical reasoning process, structured clinical context. So out of this, if you see the problem-based learning, most of the things are there. So there you get the motivation for learning, there will be self-directed learning by the student themselves, and the clinical reasoning process also comes in this problem-based learning. So in problem-based learning, develops a lot of skills, especially in the students. There are a lot of skills developed. One is the information skill. They go and search for particular information on the topic or the problem given. They get a lot of information, and the information skills are there. Problem solving skills. When they are given with a problem, they are going to go for the brainstorming session, discussion, and they wanted to search how to solve this problem, and they come out with a lot of ideas. Thinking skills will develop. The teamwork skills, this is very, very important. As I've told in the beginning, the teamwork is very important whenever you do a work. So this particular problem-based learning helps them to work as a team, because each and every one will contribute to this problem, and they will be discussing about it and come out with their own discussions. The time management skills, within the particular period of time, the problem has to be solved. Communication skills, whenever this is an opportunity where each and everyone can talk. It is not only the teacher or the lecturer keeps talking. Computing skills, that is making everything right in a concise form, in a computed way. So problem-based learning, here I have taken few literatures from where this problem-based learning was introduced, and they are very successful. For example, a survey was conducted in the 4th baccalaureate degrees, especially in the respiratory therapy programs in South Central United States, where they compared with the traditional method of learning. What happened was they found out that student performance had improved a lot when compared to the traditional learning, especially when they go for problem-based approach. The problem-based is implemented into the dental curriculum also, and especially in the Harvard School of Dental Medicine, and it had given a very good result. They have showed significant improvement in communication with the patients. The critical thinking is improved, individual learning and substantiative improvement in small group setting, self-assessment and teamwork. A study was also conducted in nurses, and it was found that the strong suggestion was there to implement this problem-based learning in the curriculum, owing to its superlative student satisfaction. So here in problem-based learning, what is expected? From the student, what is expected? From the teacher, what is expected? Students, they need to integrate and study. They need to know the line of treatment for a particular disorder or particular disease or a particular treatment part. They need to intervene each other whenever they discuss. Here the teacher has to be a facilitator. He is not going to teach anything much, but he will facilitate, he will kindle the minds of the students by giving some triggers. When I say triggers, by giving some clues. So that is how the problem-based learning works. So he is a motivator here, he's a skill enhancer, and also remember that knowledge transforming into skill is the basic idea of this problem-based learning. Especially when you see the PharmD people in 5th year, they do the clerkship and project. This is again, they apply the knowledge, whatever they gain all the 4 years, and they learn. It's a part of experiential learning. Whereas when they come to 6th year, they have to act individually. Whatever knowledge they have gained, they have to transform the knowledge into skill. So that is what is very important, and they exhibit the competency skill, and they become the full-fledged practitioner. They need to integrate whatever they have learned. Say, for example, they come across a patient, diabetic patient. In the first year, they would have studied the biochemistry of these sugars, right? Glucose, sucrose, all this biochemistry part they would have studied. In the first year, they would have studied about pancreas in anatomy, physiology, and health education. They would have studied about the pancreas. So pancreas is a part, again sugar, again this pathophysiology, right? Diabetes, and the treatment part, especially the pharmacology and pharmacotherapy of this diabetes. Whatever they study, they need to integrate. In pharmaceutics, they would have studied about the kinetics and dynamics of the drug. Especially in 5th year, they study pharmacoeconomics. They study about clinical research, about clinical trials. They study in pharmacotherapy. They study about the patient counseling. In clinical pharmacy, they study a lot of things. Information, drug information. So everything, whatever they study, need to be integrated, and the teacher has to be a facilitator to integrate these knowledge and ultimately help the student to learn through this PBL. So this problem-based learning, whenever we wanted to practice this problem-based learning, what are the requirements? There are 4 basic requirements. One is a good teacher, that is a facilitator. He is not teaching here, he is facilitating by giving the triggers. Facilitator. And the PBL student group, a group of students who can take up this challenge, who can take up this problem and solve it. So a group of students are required. And the designing, that is the triggers are required. You need to have the proper trigger, a proper word, or proper problem. The problem should be a task-oriented problem, and it is all time-bound problem. So PBL session has to be conducted. There are 4 basic things required. One is the facilitator, the student group, the design of the triggers, and the session, conducting of the session. Let us slowly go through one by one. The facilitator, the teacher or the facilitator should facilitate. As I told you already, it is not just teaching, blackboard teaching. He is going to facilitate by giving the triggers. He is going to facilitate by giving a problem and ask them to analyze or discuss about the problem. Right? The task of this facilitator is not just conveying the knowledge. He is just to facilitate or to kindle the minds of the students to think, make the students to think and answer. So he has to support the process of cognitive or metacognitive development in students, that particular group. The session can be assisted by the facilitator playing a role of a learner by staying silent, or creator by probing the questions. In between, the teacher can ask questions and probe them and make them to think. Right? This again forms as a trigger. Evaluator by posting in the group, and he's a modeler by stimulating the interest in the topic what is being discussed. Then the student group. So this student group, especially the problem-based learning, is the student-centric approach. A small group teaching method is required. The group learning always helps the team learning, especially in knowledge acquisition, communication skills, teamwork, problem solving, independent responsibility for learning, and sharing the information, and respect for others. So these are all the attributes which a group learning helps the students. And this PBL group, they facilitate the process of learning, they foster the self-directed learning initiatives, they engage the lifelong learning qualities, and developing the social skills that may enhance the professional relations. The next third thing is the trigger. As I told you, the trigger is the one which is the problem given to the students to discuss. Again, the trigger is very, very important. There are 3 different types of triggers are there. The open type trigger, right? The student directly knows, okay, this is the one which we are going to study. Another is single blind type trigger. That is, the facilitator or the teacher will know what you want actually from the student, right? And the double blind type is we give the recent trend, what is going on, a topic from them, and we even the trigger, the latest information will be collected by the students, and it will be again information for the facilitator, the teacher also. So double blind type trigger also there. So triggers are of 3 types: open type, single blind, and double blind triggers. The essential attributes to formulate an effective trigger or a case for the problem-based learning is the prior knowledge should be there. We need to elaborate the case, the relevant context has to be discussed, and the integration of the knowledge, self-directed learning, interest in the subject matter, and the faculty objectives. So all these things helps in the problem-based learning, and the triggers are very, very important. I'll give you some examples. Say, for example, in pharmaceutical chemistry, you can develop a trigger. Say, for example, they do some experiment, they do some chemical reactions. You can give them a trigger. Say there is crystallization process is going on. What are the factors which results in crystallization in this particular reaction? That is a trigger there. You define the problem and explore the possible options, right? So when they discuss, when the group of people discuss about this, why this crystallization has occurred, they have to talk about what solvent is used, what is the solute, what is the solution used, what are the physical conditions maintained during the reaction, the time available for the crystal growth. All those things will be exploring through the brainstorming discussion. And after discussion, they will note down and they narrow the choice. The selected variables will be done. Say, for example, the number of nucleation sites, the temperature, light intensity, nature of the solvent, all these things are the choice out of the discussion. And then the entire thing, the test ideas and obtain the further information, the student can generate the possible hypothesis and possible testing is done. Example, the small crystals are formed, slow the rate of cooling of solution. The larger crystals are produced. So when you slow the rate of cooling of the solution, the larger crystals are produced. So conclusion upon discussion and experiments. So this is just a small example in chemistry. And in pharmacology, suppose you wanted to give them a problem or a trigger, you can give them a case. Say, for example, a student with a history of asthma was prescribed with propranolol for the management of performance-induced anxiety before the exam. So during the exam time, the student get anxiety, they get migraine, they get headache, propranolol is given. But the student is already having problem of asthma. Propranolol is a non-selective beta blocker, and later there was an exacerbation of asthma, right? So when students analyze this, the common triggers for asthma, what are the other triggers for asthma? Say, for example, dust allergies or the leukotriene levels. There are a lot of triggers for asthma. All those triggers are all analyzed, and at last they come out with the exact trigger in this particular patient or in this particular case. After detailed analysis and discussion, students come to a conclusion that the exacerbation was introduced by the propranolol because this propranolol is a non-selective beta blocker, and the patients or the relatives who have got this particular asthmatic condition or COPD, this particular drug is contraindicated. Coming to pharmaceutics, a trigger can be like, for example, when they were talking about effervescent granule preparation or effervescent granule, the patient was taking effervescent granules. However, he never took this medication despite the pleasant flavor. These effervescent granules with good flavor, it is available, but the patient says that it has produced gastric irritation, right? Especially whenever this particular drug is used for gastric irritation, the patient complaints was not there. Why the patient complaints was not there, right? When you give it as a trigger, then they come out with a lot of answers that during effervescence itself, the patient has to take this to mask the bitter taste, right? When the effervescence is over and the patient takes it, it has got bitter taste, and that is the problem, that non-compliance with the drug, the patient is not taking the drug. In pharmacy practice, you say the case presentation, a lot of triggers can be there. So here, if you suit this problem-based learning, always remember that each and every step in a case presentation can be a trigger. For example, here I have given the drug selection, whether it is correct or not, right? They will have to debate on that. Whether there is any overdose or underdose, whether the patient compliance is there or not, whether any untreated indications are there, whether any monitoring of the drug is required, if at all there is any hepatic or renal damage, or if the drug, the concentration changes when it is given with the other drug, or is the drug causes some complexation. So a lot of things. The patient education, whether it is required or not. Is there any toxicity or adverse drug reaction produced? So all these, each and everything is a trigger which can be discussed by the group of students. I'll tell you just one small example. For example, a case presentation is given. In pharmacy practice, a case presentation will be done. So you'll be talking about what is the age of the patient, male or female patient, what for is admitted, the reason for admission, all those things will be there. But here, if you see the trigger, the patient has got more WBC. The total leukocyte count is increased. That means some infection is there. The hemoglobin level is again a trigger here where it is less than the normal value. Right? The BP is more, pulse rate is more. And if you check the liver function test, right, the enzymes are elevated. If you check the LDL cholesterol, the normal is less than 100. Here it is elevated. Sodium levels, it is less. Normal is 135 to 155, whereas the sodium level is less here. Hyponatremia is seen. Each and everything is a trigger here. So the students, the group can be allowed to discuss on these each and every trigger. And ultimately, the other investigations, whatever is done, also give, say, for example, the brain natriuretic peptide is 600 picograms per ml. The patient has got atrial fibrillation. Low ventricular ejection fraction is seen. It is only 35%. All these things are triggers. Even though lots of information are available, the triggers should be identified by the facilitator, that is the teacher, and they have to discuss all these triggers. So when they discuss these triggers, they will come to know what are the problems to be identified in this particular patient. Say, for example, here decreased fluid overload, right? You have to decrease the fluid overload, the heart failure patients, right? Ischemic heart disease is there, so antiplatelet and statins need to be given. They maintain the BP, right? Because since the diabetic patient, they have to keep the BP less than 135 or 80. And the glycemic control should be checked. The HbA1c level should be less than 7. The therapeutic INR should be between 2 to 3. The low molecular weight heparins or the oral anticoagulants need to be given to control this atrial fibrillation. This, to achieve the cholesterol level to normal, that is less than 100 milligrams per DL, they have to give this anti-cholesterol drugs. So all the problems have to be identified, and once they identify, they have to check whether accordingly the drugs are given or not. Here a lot of drugs are given. Say for example, tolvaptan is given. Tolvaptan is given especially during hyponatremia. Whenever the sodium ions are less, to increase the sodium ions, this particular tolvaptan is given. And especially in heart failure patients, the sodium ions, if it is less, the pumping action of the heart will be less. And that is why this tolvaptan will help them to improve the pumping. So discussion on each and every drug can be made as a trigger. And at last, they can come out with the points for that particular case. Say, for example, in this case, a diuretic is there, spironolactone is given. Suppose if furosemide is given in this case and NSAIDs are combined, what will be the problem? They reduce the renal prostaglandin synthesis and they can lead to nephrotoxicity. Loop diuretics can cause hyperglycemia. Liver enzymes are elevated, but it is not taken care. No other drugs are given in this patient. Tolvaptan is there. It can result in increased statin plasma concentration. Even though it is given for reduced sodium levels, when statins are also combined with this drug, it can lead to increased statin plasma concentration. So the statin levels or the dose has to be reduced. No therapy was given for diabetes, even though the patient has got the past history of diabetes mellitus. And also, whenever diuretics are given, we have to check for uric acid levels because diuretics can cause hyperuricemia. So like this, each and every point is a trigger through the facilitator. That is, the teacher has to give them a trigger and ask them to discuss each and every point. Since it is a group, each and every person comes out with different ideas, and ultimately they take a lot of information, a lot of points after the discussion. So increased urea may be because of dehydration, right? And decreased left ventricular ejection fraction can lead to decreased perfusion pressure and decreased blood supply to other parts of the body. And the increase in the brain natriuretic peptide, BNP levels, it is mainly in heart failure. You can see these BNP levels are increased, but there are other conditions like asthma, COPD condition, pneumonia, all these conditions also, you can see the BNP. So all these things need to be eliminated and check which is the right reason why these BNP levels are indicated. So this is just at the end of the PBL session, you need to have the discussion points and everybody will be knowing a lot of information. The student will be getting a lot of information at the end of the PBL learning. So PBL learning, it acts as a platform to integrate and apply the knowledge gained. It's evidence-based care in clinical practice and part of assessment and appraising the student knowledge, and the ability to analyze and communicate improves during PBL. So each and every activity, the pharmaceutical care activity, what is expected by the clinical pharmacist in the hospital, each and everywhere you can include or incorporate this problem-based learning and make the trigger and the group to analyze the trigger and come out with a lot of points during discussion. I'll give you one small example here. A case is given, a male patient of 50 years old has got chest pain, retrosternal pain radiating towards the left upper limb with breathlessness. The BP is 150/90, serum creatinine is 1.9, and smoking since 25 years, and he is also a known case of coronary artery disease and recently identified with systemic hypertension less than a month. And the medications given to him are clopidogrel and propranolol 20 milligram. And what is the right choice of drug when the patient is having systemic hypertension? All of us know that whenever a newly identified systemic hypertension patient is there, the first drug of choice is diuretics. But diuretics have got their own problems. Lot of category of drugs are there: ACE inhibitors, ARBs, beta blockers, calcium channel blockers. But which drug suits this particular case? That is what is the problem there. So each and every drug has to be analyzed, it has to be discussed by the team, by the group, and the facilitator has to facilitate. Suppose thiazide diuretics, what are the problems with thiazide diuretics? You can ask which one of the following category of drugs, antihypertensive drugs, can cause increase in the uric acid levels. Then they have to analyze and they have to find out the answer that thiazide diuretics, especially the diuretics, are the one which can cause increase in uric acid retention. So each and every drug has got its own disadvantage, and we have to keep analyzing the ACE inhibitors, right? There are 3% of the patient who can develop angina. Right? So whether this drug is right for this patient or not. So ARBs can cause hyperkalemia, right? So whether this particular drug is suitable or not. Beta blockers, right? Especially it has to be used with caution whenever the patient is having vascular disease. Calcium channel blockers, this does not produce any electrolyte disturbance, and this particular drug is a drug of choice for coronary risk patients. So like this, you need to discuss and come out with a final solution that which drug or which category of drug need to be given for the patients. A lot of examples I can give, but just 1 or 2 examples I've taken here. Another patient, a known case of diabetes, hypertension, atrial fibrillation, and a cerebral venous sinus thrombosis. This patient has complained of melena, right? The blood in the stools, and on examination, abdominal distension was there, and the doctor has given them the class of drugs where the amiodarone is there, warfarin is there. So INR is 7, and when the discussion was carried out, we found that amiodarone and warfarin, it has increased the elevated INR. That is the reason for increasing the elevation of the INR. So it has to be reduced, and the dose of warfarin has to be reduced, and the recommended dose they have to find out from the literatures and they have to discuss here. So the problem, the trigger is given. This particular patient elevated INR. That is the trigger. So once elevated INR, then the student has to go and find out which drug can cause increased INR, what is the component or what is the effect when the other drug is combined and given. So a lot of things are there. Say, for example, you can give a trigger as the group of antibiotics which can cause convulsion. So this levofloxacin, the fluoroquinolone group of antibiotics, there are a lot of reports that it produces convulsion, especially when they combine with diclofenac. The convulsions are more. Each and every trigger, say for example, clopidogrel ribiprazole combination is a deadly drug interaction, major drug interaction. The enzyme responsible for the breakdown of one another is blocked, and ultimately it can cause stroke, ischemic stroke. Nitrofurantoin, citralca, individually they are very good drugs for the treatment of urinary tract infection. Citralca, its citrate will reduce the acidity. It's a systemic alkalinizer, and it is very good to bring the microorganisms outside in the alkalinized urine. The acidic microorganism will come in the alkaline urine. Similarly, nitrofurantoin is a very good urinary antiseptic, but the combination of this will not work out because the nitrofurantoin requires acidic media for its function. Whereas the citralca, when it is given along with nitrofurantoin, makes the medium alkaline. And that is why it need not be given, and it should not be given together. Spacing should be given. Individually, the drugs are very good. It is useful for urinary tract infection, but it should never be combined together and given. Similarly, pioglitazone, insulin combination is a deadly combination, right? There are a lot of congestive heart failure has occurred. So whenever a patient is with insulin, always remember that pioglitazone should never be combined. Statin-induced diabetes. You can just give a trigger diabetes induced by statins. That's all. So once with this trigger or a problem is given, the student group has to go analyze what are the different statins which can cause diabetes, what is the mechanism by which the statins can cause diabetes, right? So what is the maximum dose of statins which can be used, right? So what is the way by which this diabetes can be uh, reduced when statins are given? So all these triggering points will help in group discussion and come out with a lot of points. Similarly, aspirin and anti-cancer. Just the trigger is like this, aspirin and anti-cancer. So they have to go and check whether aspirin has got any anti-cancer property or not. So a lot of studies, Cancer Research Center in UK, a lot of studies conducted where they come to know that this aspirin has produced good effect against cancer. So the trigger is just given, and once the trigger is given, the discussion has to be made, and see to it, after the discussion, the entire points have to be summarized and they have to come to a conclusion. This is again one thing which I want to tell you this, whenever you are there in the war rounds, the insulin dose calculation, the students find it a little difficult. It is very simple that the total daily insulin requirement is 0.2 to 0.4, or otherwise if you know the how much this one is, say for example, the weight of the patient, if you know in kgs, right, multiply by 0.55, that much is the dose required for the patient. Or if it is in pounds, it has to be divided by 4. That many units is required for the patient. Of course, all of us know that we have the sliding scale for insulin. Whenever there is less than 150, no insulin is required. 150 to 200, for every 50, there is increase of 2 units of insulin. There is another is there, each unit of insulin, how many milligram of sugar it can reduce. So rule of 1500 and rule of 1800, just the triggering here is just give them rule of 1800. Let them go and find out what is this rule of 1800. Then they will come out with all these calculations. So just the trigger is given and ask the group to go and come back after some time. They refer everything, they come and discuss. Or give a problem. Say, for example, a diabetic patient and a hypertensive patient receiving thiazide diuretics with insulin atenolol, sugar did not control. Then where is the problem? So they will go and find out this particular combination, what type of drug interactions are there. So thiazide diminishes the insulin response and potentiates the hypertensive effects of a beta blocker. Similarly, problem 2, an hypertensive patient taking AC inhibitor and theophylline, they ask for ibuprofen and cetirizine for body pain. So what happens when they go in the OTC medications, ibuprofen reduces the action of AC inhibitor, and decreased clearance of cetirizine is seen with theophylline. So instead of directly saying these answers, just give it as a problem to them and ask them to discuss in the group and come out with the solution. This is one thing which when I have experienced when I give this Jntua medications, right? Just I gave the heading as Jntua medications. So they went and searched, they found out what is the difference between the brand name and generic name, right? They could learn a lot of things, what is the similarity and differences between brand name and generic name. They also learned about various just a minute, slides or not. They also learned about the history of it, how this Jntua medicine, this particular, this thing was launched in India, when it was launched, which are all the places first they have started this, entire history they have learned, which are all the companies which are manufacturing the medications for Jntua. All these informations individually, I have not told them anything, just I gave them one trigger, Jntua medications. They went and searched all this information, and at the end of the discussion, we could get a lot of informations. Right. So where do they test all these medications quality? That also was raised by one student, and they went and searched. They come to know that the National Accreditation Board for Testing and Calibration Laboratories, they have these laboratories, and through them only the quality is assured for all these Jntua medications. They also come to know that the Sun Pharma was the first Indian pharmaceutical company to recognize and take the advantage of the generic market. Right, a lot of informations are brought by the students. In fact, for us, for me also, it was a lot of information, which first-time information. When the students, they go extensively, they search, they discuss, and they come out with the solution or the points. Even one of the students has gone to such an extent that some of the medications were below the standard quality, and they are all taken, the sample were taken by the people, and a lot of information they have shared on this. Similarly, once when there was NDMA, nitrosodimethylamine problem was there in some of the medications. So when I gave this trigger, this trigger was taken and they went and searched extensively. They come to know with a lot of medications, a lot of places or the countries where they have stopped this medication. Even they come to know that this valsartan is one where it was, even though it is used to treat ARB, it is used to treat high blood pressure. This particular valsartan has got a carcinogenic substance. When they prepare, the active pharmaceutical ingredient has got this NDMA, that is N-nitrosodimethylamine. Similarly, atorvastatin recall. Atorvastatin recall was the trigger given here, and they come to know that Dr. Reddy's laboratories, they recalled around 236,000 bottles of statins from US, right? A lot of informations were gathered just by giving a trigger. So in case of problem-based learning, always remember that facilitator role is very, very important. The teacher role is not just teaching, not just giving information. He has to facilitate by giving a trigger. Trigger means the problem. Once the problem is analyzed by the group of people and they come out with a lot of points, then the discussion goes and the facilitator has to see to it that the discussion is made fruitful. So always remember that traditional learning is just to tell what we need to know and memorize it, a problem assigned to illustrate how to use it. Whereas the problem-based learning is problem assigned, identify what we need to know and learn and apply it to solve the problem. So always remember that learning is experience and everything else is just information. I have not told, Albert Einstein has told this. So thank you so much. Let us take this problem-based learning into the students' activity, daily activity for better learning, right? So everything big has to be start from a small thing. Always remember that the first step in the evolution is to believe yourself. Yes, I can take care of my students through this problem-based learning, and I can make the learning a happy experience. So thank you very much for the patient listening.
Sir, thank you very much, sir.
Thank you, sir. Thank you.
Sir, Sriram, sir, excellent session.
Thank you, sir.
No, you are the only one person having the passion for teaching and commitment and dedication.
Oh, thank you for all your words. It's all because of students.
Sir, please be here.
I tell you, whatever learning as a teacher, I have learned a lot of things through students. We have to accept it. There is no other. This is the fact. We need to accept it.
Good afternoon.
Another one is, no, you are the more than the teacher.
Sir,
Namaste, sir. Namaste.
Tirupati.
Hello, sir. How are you, sir?
Namaste. Nice to see you.
Thank you, sir.
Nice. I could not join your lecture, but I could only come now to give my session. It is nice. Last few slides, motivating slides I have seen. Nice to see you on the screen after a very long time. How are you? How are the friends back in Sri Ramakrishna?
Everyone are fine, sir. Everyone are fine.
Yeah. Nice.
Corona has become my friend now, including
Corona. Correct. You are in a hospital.
Yes.
You should be much more careful than compared to other people.
Yes, sir.
Yeah, this online platform will really give a great opportunity to
sir, 5 minutes.
All of us. Right. Go ahead, Mr. Dr. Gopi.
Sir, 5 minutes, sir. The topic is open for discussion. My dear faculty members, if you have any queries, please. Maybe you will give your query in the chat. Sir, Sriram, sir, no, you are the only one person in teaching with fascination and passion and dedication, commitment, and more than the teacher, very good human values.
Sir, being human is very important. Nowadays, that is the very, difficult job, being human. Anyhow, teaching profession keeps us that human being, this one, being human is one thing which we can express in teaching. This is what I could learn. And it's a lifelong learning. Education is a continuous learning process. And that is where we teachers have a lot of role to motivate our students.
Yes. So thank you. If there are no questions, the Vani, please give the vote of thanks to the Professor Sriram sir.
Yes, sir. Sir, thank you, sir. This is a very informative session. Our sincere, heartfelt gratitude to Dr. S. Sriram sir, who has presented the whole gamut of information and problem-based learning, which is an effective tool in integrating theory and practice. Sir has rejuvenated the teachers by explaining how we can make a student proactive in classroom by bringing an analog with cellular components. Sir taught us how to inculcate morals on practice for both students and teachers. Sir has narrated how a teacher can get absolute happiness by delivering students thoroughly. Sir has explained how problem-based learning makes classroom a wonderful arena to flourish our knowledge. Sir has clearly explained about the adverse drug reactions associated with various types of drugs, and we have to be thorough that are the main adverse drug reaction associated with each and every drug. This lecture has given how better we can teach clinical pharmacy for postgraduate students. And finally, thank you, sir, for your kind acceptance of our request to energize the registered pharmacist with sound and knowledge on problem-based learning, which is an effective tool in integrating theory and practice.
Thank you so much. In fact, it's my privilege to be associated. Thank you so much for the opportunity.
Dr. Gopinath, sir, for giving.
Thank you, sir. Maharaj,
Thank
sir.
you, sir. Sriram sir. Once again. Thank you.
Thank you. Convey wishes to all our friends in Sri Ramakrishna.
Sure.
Gopal Rao.
Sure.
All those people, all my friends there. Yeah.
Thank you, sir. Thank you.
Good afternoon, sir. Nagraj, sir. Namaste. How are you, sir? I am Umarani, sir.
I am not
Nice